Alright, hey everybody. Thanks for coming out. Sorry for the late start. My name's Natalie. I'm a member of Students for Health Equity. I just wanted to take a second to thank everybody for coming out and thank our panelists for coming to share their experiences working on the Trauma Center campaign and other issues relating to health inequities. I know that I got involved in the campaign after coming to an event like this and hearing the experiences of those who are involved and realizing how important the issue was and how dedicated people working on it were. So I'm really excited that everyone's here today. So what we're going to do is we're going to start with a short introduction of the issue. The panelists will introduce themselves and we'll ask a couple of questions. We also want to answer some of your questions too. So we'll be passing out note cards. If you could write your questions on them, and we'll collect them later in the event and give our panelists a chance to answer a couple of them. Great, so I will now turn it over to Veronica from FLY, who's just going to give us a quick overview of the issue and the campaign.
No,
go ahead.
Okay, so hi everyone, good evening. So the Trauma Center campaign got started back in 2010 after the shooting death of Damian Turner, who was a co-founder of Fearless Lady Mountain Youth, a member of the Woodlawn community, and a very important person to a lot of people that's involved with the campaign now. So we felt as if that the lack of trauma centers on the South Side was something that was it was too much of a disparity to see that there are so many traumatic injuries that happen on the South Side to so many people, so many young people, and there was nothing that was being said, let alone done about it. And so the young people in FLY came together and started the campaign with the first protest, which was on September 28, 2010, which is Damian's birthday. And we've been protesting ever since. We've done many events like this here at the university and also at different places around the city. We've been able to travel to different places and different areas to talk about the campaign and the work that we do. A lot of our work is involving young people and issues that they care about and giving them the tools so that they can not only talk to people in the community about it, but also people like yourselves and people from all different walks of life. We've sat down with politicians. We've had the ability to speak about this at the State Building downtown not too long ago. And as far as actions go, we've done 10-mile marches where we've marched from 61st and Cottage Grove to the nearest trauma center, which is Northwestern. For those of you who do not know, Northwestern and I think it's Christ, which is in the south suburbs, are the nearest trauma centers to where we are now, which is about 10 miles away from where we are now. And so just to kind of give you an idea of the distance that people have to travel while they're suffering from injuries that are dying, at the moment, very traumatic, and people need help right away. So for us, it's important because not only do we ourselves live on the South Side, but a lot of people that we care about live on the South Side. We feel like everyone should have access to this type of care because you can't control trauma. It happens, and when it happens, the best thing for it, once it happens, is to treat it. And a lot of people are going without that treatment. And a lot of families are losing loved ones, and we feel like it's unnecessary. And so we've been at this for the past 3 years. We've been continuing to work hard and build relationships with students like she, and we're grateful to be here. We're grateful that everyone is here to hear about the work that we've been doing and that she's been doing, and a lot of different people have been putting into this effort because it is now it is a Southside-wide effort. We have a coalition that we're working and we're moving forward in this year, and so we hope that everyone here can be a part of it.
Awesome, thanks so much.
Thank you.
Okay, so now our first question for the panelists. Maybe first say your name, and then maybe talk a little about why you got involved with the campaign and what the campaign means to you specifically. So, Dr. Lionel, we'll start with you and let's work our way down the line.
Yeah, sure. My name's Evan Lyon. I'm a general medicine doctor and internist. I work at the hospital. I've been here about 3 years at the University of Chicago. And I live on the South Side, so in part the issue is personal because this is where I live, down in South Shore. In large part it's personal because I'm a doctor and care for people. And it's also personal because I work at this institution which isn't taking care of its community. The disconnect between the need and the resources is really unjust. And so I think it's an easy campaign to support. I hope that all of you, if you're not involved already, will continue to be involved and to learn more about it. I want to be brief so everyone can speak, but I think it's also crucial for me, coming from the vast majority of my work has been in Haiti, in a different context, but where people are poor, like they are on the South Side, where there's not enough resources, where on this issue there are not enough resources, and even for primary care, for a lot of different medical needs, there just isn't enough that's done for the community. And from the work that I've done in the poor world over 15 years, it's impossible not to see the connection between social forces and people getting sick. Really, that's the root cause of why people are sick. It's the root cause of why people are dying. We know how to treat trauma. We know how to treat hypertension, diabetes, and many other things. But if that resource isn't accessible, if people are not, if people don't have the help that they need, and if we don't address the underlying issues, which are poverty, race, social, educational inequalities, all the other forces that make someone vulnerable, we'll never get to the bottom of this. But something like a trauma center is doable. It's work that's been done here in the past. There's no real reason it can't happen again. So I think it's an important thing to keep supporting.
My name is Kyra Jones. I'm a youth organizer here in the Body Group. And I started this campaign 3 years ago when my brother Damien Tanya died. When he died, it wasn't right. It didn't sit right. I didn't feel like it should have happened to him. So me and a bunch of other youth that knew Damien, we got together, we formed a meeting, and we figured, everybody else got trauma centers. They it's close to them. Why don't we have one close to us? So we figured university is a well put together hospital. They got a lot of resources. They got a lot of funds. So we figured, why don't they have a trauma center? So of course we got together and we figured we want them to have a trauma center. So we've been doing a lot of campaigns and stuff. And after I started going to meetings and going to events, I figured, if us youth could do something like this, why not let the whole world know what we could do? And like, we come together, we try to make our community better. So nobody got to look down on us, and a lot of people ain't got to continue to get hurt. A lot of people lost their loved ones, and it hurt them deep inside. And it's like, I'm tired of seeing people getting hurt. I'm tired of seeing people walking around devastated because they don't have their loved ones with them no more. And it's like, we need a change, and we need it now, like for real.
My name is Veronica. I'm also a member, a youth organizer with Field City Mighty Youth. I was also there with Kyra in those beginning meetings when the Trauma Center campaign got started. So that's how I got involved. I didn't know Damien personally or for that long, but I briefly met him before he passed. And to come to those meetings and to see the amount of youth that one youth was able to touch and inspire to want to do this type of work, because it's selfless work, it's sacrifice to do this work. It's a lot of time and effort that you put into caring about not just yourself, but a whole population of people. So it's definitely something that we understand is bigger than us. And so to just see that, and that type of spirit happening in my community with people my age and even younger than me, it was definitely something that I wanted to be a part of, and that I wanted to stick around. As far as the Trauma Center campaign, I feel like it's important, but what it means to me is that young people are able to bring something to the community that the community not only needs, but that they feel is right and it's justice. Like, it's not a lot of times you see young people, telling a $1,000,000,000 institution, you need to get your S together. And that's what we're doing. And to me, this campaign, even though it does mean a valuable resource that our people need, also means leadership and power that our community needs, and that especially our young people need in a time where we're seeing so many of them die and lose their lives or give their lives to things that aren't worth their life at all. So that's what the Trauma Save campaign is to.
So my name is Phil Verhoef, and I'm a physician at the university also, and I work in the intensive care unit. And I work both in the children's hospital and in the adult hospital. And just so that it's clear to you guys what the ICU is, you'll say, is that the emergency room? No, it's not the emergency room. It's not the operating room. It's basically the place where you go when you are as sick as you can possibly be. So I take care of patients that have sustained traumas. I take care of patients that have had surgeries. I take care of people that have had strokes, heart attacks, the whole kit and caboodle. And so the perspective that got me into this a little bit is that at the University of Chicago we have a pediatric trauma care center. So, we have Comer Hospital, which is our pediatric hospital, and that serves kids up to the age of 15 who are in traumas. But then once you become 16, you're no longer able to be brought to the hospital here if you have a trauma. You have to be brought to Christ or to Northwestern or to County or one of the other trauma centers, depending on where you are. And so that's given me a first-hand opportunity to compare the difference between what it is to serve a community for trauma care and then what it is when you can't anymore. So, I can see how much benefit we provide for anybody that's 15 years or under in trauma care services. So I've taken care of kids with crazy gunshots, crazy car accidents, kids that have had swing sets fall on them, kids that have fallen off this and that and these and those. And so the thing that started to get me thinking was, how is it that when you turn 16, suddenly the university is no longer willing to take care of people that sustain these kinds of accidents, whether they're just crazy freak things or whatever you got yourself into. And so at that point, I've been here since 2009, and so I watched sort of the evolution of the trauma care, the trauma center campaign start. And so I started to think, what is this really about? Why is it that we have this shift, this change once you turn 16? And I think fundamentally, or at least a large part of it, it's about money. And so the other kind of advocacy hat that I wear is one where I advocate for universal health care, where I believe that health care is a human right for people and that there should be nobody that doesn't have access to basic health care for any reason, because I think that's part of the driver of all of this inequality and this inequity that we see. I think that drives poverty. I think it drives segregation. I think it's racist. I think there's structural violence in it. I think there's all of these that are components to that. And so the other thing that I do is advocate for that kind of healthcare reform. And so for me, becoming more involved in the trauma center campaign was a way of acknowledging some of these disparities and actually finding a problem that has an easy solution. Because frankly, advocating for healthcare reform is a disaster, and there are all these forces that work against it. So I think advocating for a trauma care center for adults hits a lot closer to home for me, but also is related to a number of the same issues that I believe in. So for me, if I believe that healthcare is a human right for everybody, here we have a situation where there's a lot of people that are being denied that right here on the South Side, and I believe then that we should work to fix that. So I've spoken to people, and I testified at the State House and or at downtown, and I'm trying to provide some perspective of what it's like from within the hospital on this campaign, because I have some experience with how hospital systems work and insurance works and these kinds of things. So that's my interest in it, because I believe that everybody deserves equal access to health care, no matter who you are and no matter where you live, and that this is one way that I can fight for that.
Great, awesome, thank you so much. Okay, so the next question we have for you is, in your personal opinions, what responsibility should the University of Chicago Medical Center have to the surrounding community?
What you guys think?
Actually, before we start, I'm going to start handing out these note cards so you can write questions on, and then I'll be like coming back and forth and you can hand out to me.
Okay. So we basically feel like the main responsibility that the university has is one of a health facility and a health provider to this community and the surrounding communities of the South Side. And with that being said, we understand the community is in a spot where they see the violence that people talk about on CNN and ABC and everywhere all over the country. The Chicago is the city that is a cesspool of dead bodies of mainly young black people. And the university is sitting in the middle of that. So as far as the community is concerned, they have a responsibility to not only acknowledge that epidemic that is happening, but then address it because they have the resources, the capabilities, and all those other things to do that. And then on the second hand side of it, they're their neighbors. The university is a massive, like, you can't miss it. You can see it everywhere. And there's new buildings on 63rd Street, on Drexel, on the island, and 60th. They tore down the old hospital there, and now there's this new laboratory school for young children. And they're continuing to build, and they're talking about giving the university the Obama Library, and it's like, can we have some sugar or something? Like, the people in this part of the city are dying from trauma. That is a fact. We have had doctors like Dr. Marie Crandall, who has produced studies to show the numbers of people who are dying from trauma care and having to travel so far, and how those travel rates affect those mortality rates. And the university is not blind to any of this. So they are responsible because, you know, that old corny saying, right? To say nothing is to agree to something, or how did it go? But that's basically what they're doing. And then we feel like that's irresponsible, and they need to get their ass together.
I mean, I think that if there weren't a problem here, the university wouldn't have a responsibility to deal with it. But the fact is, you said it well, that they need to acknowledge the nature of the problem, but then also recognize that there is no other obvious solution to this problem other than one that I think comes from within the university. I think it's a university with a tremendous amount of resources and power in the community. And I people have talked, well, maybe there are ways that we can get the university to work with other hospitals and find a solution within that. I think that's great. I think that's a fine idea. I don't see any other institution on the South Side that's as well resourced as the university. And so it's harder for me to understand why, with all of these smart people here and all of the money that's here, that a solution cannot also originate from within this community.
Okay, well, I'll go quick. It's interesting that the question of a disconnect came up. I think, clearly, like Phil said, this is a place to do this. There's a big problem. We have the resources to do it. All the capacity that's needed to create trauma centers on this campus. We have a reasonable emergency room that could be made a whole lot better. That's kind of a separate issue. in some ways, but we have surgeons, neurosurgery, anesthesia, critical care. We have all the pieces. They're here. They would just need to be capacitated and organized. And I think there's also, you bring up this sort of not recognizing the problem. This university has really some excellent scholars of these exact questions about interpersonal violence and trauma. There's a place called the Crime Lab that was just given a MacArthur Genius Award within the last couple of weeks, which is one of the better places for understanding interpersonal violence and possibly working on ways to solve it. But what better way to prevent violence than to work at the upstream to give people a chance if they are harmed? There's no proper prevention without treatment in almost any realm, and there's that's a horrible disconnect. If we're sitting here studying our community, becoming experts, getting Genius Awards for the study, but not taking care of the problem, that's not right. So those are my 2 cents.
Like Lady B said, or Veronica. But like she was saying, like they know, the university know what's going on. You can't act like they don't. They know what's going on. Like they right down the street, you see what's going on. Mm-hmm. And it's like you taking all these resources, all this money, and throwing it on the others, making it rain on other things that you can't do a level 1 trauma center. It don't take much. You got the money and resources to hire some nurses, hire some doctors, y'all got all that. And it's not making no sense to me why they just can't, do it. It's not that hard. And it's like, they just, they did a building. They put in $700 million in that building. Mm-hmm. They could have took that, the level 1 trauma center is like $20 to $40 million, Mm-hmm. They could have just took that half the money and just did a trauma center. It's not that hard. And it just don't make no sense to me why it's paying with it. That's my question.
Okay, the next question we had was for Dr. Lyon and Dr. Burrell specifically. The question is, how does the lack of trauma care affect the doctor-to-patient relationship?
Yeah, that's a good question. Maybe Phil, you can answer first. Because you get to take care of trauma.
Yeah,
I don't.
I think for me as a physician, it's really satisfying when I work in the children's hospital to be like, there's nobody that I can't take care of. Disease, there's no, there is like nothing that I don't have resources to care for. You come in with kidney failure, you come in with heart failure, you come in with lung failure, you come in with trauma. It doesn't matter. And I like that feeling. I like caring for patients and families and knowing that I can really serve them. And so it always is a little bit heartbreaking to know that, that I can't care for everybody once they're over the age of 16 who rolls into the adult ER. And, the ICU is a little bit of a funny place because, if you're in Woodlawn and you end up having a stroke, you got to come to the University of Chicago before you go anywhere else, and then I get to take care of you. But if you end up having a trauma, then that's sort of a horse of a different color. The paramedics know, based on what they find, that when they come to the scene, they know that they can't take that person to the University of Chicago. So in a way, it's like there's this whole gap, or there's this whole range of people that I don't take care of at the University of Chicago, and I think that's kind of a shame. It's the one thing that we don't do, that I don't do for caring for adults, and so that just bothers me a little bit, because I came specifically here because it's a great university, but I live in the neighborhood, and I live here because everywhere I've always been, I always walk to work because I just believe in living and being a part of the community that I'm serving. And so, that it goes that way for me here, and it did when I lived in Los Angeles, and it did when I lived in Cleveland, and everywhere that I've been. And that always just feels like a little bit of a shame that, you know, even if it was me and, you know, I chopped my arm off with a saw, I can't go to the University of Chicago. I've got to go up to Northwestern or wherever. And that just doesn't feel quite right.
I would just add briefly that a big part of the work I'm doing now from within the university is trying to reach out into people's homes and start doing home visits, which is, you know, really Haitian technique. It's kind of poor world technique, but it's deeply needed here. There are a lot of people who are isolated in their homes, not mobile, can't get out, lack the support to plug into the medical system. And so at least as a practitioner, that's where a lot of my energy is going. And it's miles harder because the university has a reputation for not taking care of these things. And so people correctly look at me with distrust. People correctly identify me with the University of Chicago, and already I'm on the wrong side of things. And we'll keep working to change that in this room, I think, very substantially, and through some of these other things. But it affects everything that we do when you create an artificial limit like this, and especially when there's so much injustice and suffering behind it. I think it affects all levels of care, certainly having an impact on how I'm able to reach people who need kind of basic primary care. At least that's been my experience this week.
Great, thank you. All right, now this question again is for all of our panelists. How do race and class play into the issue of access to healthcare, or in this case, lack of access to healthcare?
Okay. So, America. I answered the question. Resources for people in this country is, especially poor people in this country, are already limited or disappearing or null and void. And so, with healthcare being such the big business that it is in 2014, a lot of hospitals prefer to invest money into research and treating things that are more lucrative to treat. And unfortunately, trauma care is not lucrative at all. The hospital loses money because there is no way to filter that patient. If you come to a scene and there's a trauma patient, they have to go to the nearest trauma center, and that's just it. And so that means you walking into a situation, especially on the south side, where 8 times out of 10, that person either doesn't have health care or has public health care. That's not going to fully cover what it really takes for the hospital to treat that. So that means that accessibility to healthcare, or even just like fair accessibility to healthcare for poor people, is a dream. And when you have hospitals like the university, like Kyra stated earlier, that put $700 million into new buildings, almost $60 million they receive in tax breaks, and only give $10 million to charity care, and you have all of these people around them that don't have any health care. They're a part of the problem that's creating that large gap in the disparity. And they're a big thing that's sinking down that hope that people have that I can be poor and still have a chance at being healthy. Because that's what, at the end of the day, is what it is. For a lot of people who work for these facilities, like Dean Polonsky, who is the highest paid dean ever, like, he can treat himself. He has the money to be treated, and that's it. And I don't. I ain't seen no doctor in years. That's the honest truth about it. And these are the things, these are the realities that people are living with. And some people say, oh, that just sounds so extreme, but it's not extreme, it's everyday life. And so we need hospitals like the university who have the capacity to do it, because other hospitals like Providence don't have the capacity to do it, probably want to have the capacity to do it and can't do it. We need the university to step up. Because even if, let's say we open up a trauma center, we put it at Trinity Hospital, it's there. Trinity Hospital by itself probably can't sustain a trauma center for that long. not without another hospital assisting it, without some type of network created, some type of real support. If not, then we're just pacifying the problem. We're gonna get y'all a trauma center for a year, see how that make y'all feel, and then that trauma center is probably gonna close because it's not enough money to fund it, and he's still back out here asking, can y'all please help our people to stop dying? Can you treat the trauma that is going on in our community? So, I don't know if I answered the question, but yeah.
I'd add quickly that, especially along racial lines, and certainly race and poverty everywhere and in this neighborhood for sure, run together. I think one of the great and saddest aspects of this is that the university feels comfortable ignoring the community. And to put a slightly positive spin on things and to praise the work that's being done, that can change. That's what we can actually change by organizing, by getting ourselves together, and by creating a coalition that's going to be loud enough and strong enough until they can't ignore us. Up till now, the university's ignored the community. And there's a huge racial component to that. But that can change.
It's a complicated question. One of the things that I was thinking about as I walked over here is that there is a real, we talked about disconnect already, but if you listen to what the university has said, they have said that we are doing things for the community, and then they list a number of things that they do, and you can't dispute that per se. I think the issue is, are they impacting the community in the way that the community thinks is meaningful? Or are they sort of, does it seem more like lip service, or we're doing this so that we can say that we're doing it? And I frankly, I'm not going to disparage the work that the university does within the community, because it's good. But I think that what needs to happen is for the community's voice to be heard, saying this is not, that's great, that thanks for what all you're doing, but really this is the thing that we think that we need. And to the extent that it's a Hyde Park and Kenwood and Woodlawn are interesting neighborhoods, and I love living down here. I hate to make it a race issue per se, but that's the way it ends up shaking out. And I think that is a shame in a place that's potentially as potentially effective as this university can be.
I think another reason why it shapes up to being a race thing is if you look at who is the main population on the South Side that's suffering from trauma. Why doesn't the university want to treat them? The main population, those maybe you don't know, is young black men. Ages maybe 12, 25. So, as we stated before, the money's there. So the money argument is kind of a slap in the face to us. So then we ask, then, if you have the money, if you have the resources, why? And the community feels it's because you don't care about young black men. Yeah. Pretty good.
Okay, awesome. All right, next question. Okay. So moving forward from here, what do we need to do to get a trauma center on the South Side? And what role do you think university students can play in this?
What we do what's been already done, everybody, well not everybody, most of the youth came together. What needs to be done is more people, more support, more people showing up, giving support, and the students, what y'all doing now? Y'all supporting. That's all we need. That's all everybody needs, support. more support means they'll look like, okay, everybody's coming together, you know, we need to really step our stuff up. We need to get us together. Everybody, you know, coming together, they know what's going on. So it's like, if the university sees the community plus others and others and others come together and tell them, we need a trauma center, we need some help, we need change, they bound to do something about it.
It's pressure to do something about it. And in concrete support, like things like a student, and these are just ideas I have, but a student-wide lettering, like students writing the university and saying, I, as a student of this university, a part of this community, care about the fact that there is a lack of trauma care happening and that my institution can do something about it and is not doing anything about it. Even parents saying, hey, I pay tuition for my child to go to school, and if he or she ends up in a car accident, God forbid anything worse, there's nothing that you will do, and I'm giving you tens of thousands or hundreds of dollars for my money. That's a problem. Also, alumni play a big factor in it because alumni donate money back to the school once they take their degree and make all that money and give it back to the school. And if we had the alumni saying like, yo, that's not cool. We care about that community. We lived in that community. That community was our community for this X amount of years, and it shaped us. And we feel like, you know, we should be reinvested into that community. It takes politicians to, never mind. but we need them too. Politicians like, good examples are Congressman Bobby Rush, who proposed a bill that says we need more money in this entire country for trauma care. And there needs to be more funds for trauma care. And more, mainly, importantly, it takes relentless people to be dedicated to making sure that change not only happens, but it stays and it's stabilized. Because like I said earlier, we don't want just one trauma center that's going to wither away. We want an entire network that can support an entire population of people who deserve that care.
I think you said something incredibly profound that I just want to reiterate. You guys are paying to be here. Dr. Lyon and I actually get paid to be here. And at some level, I actually don't think either of us are at risk of losing our jobs over this, although there are other things I do that might get me to lose my job. But, you know, the university depends on you. And if there is a complete, you know, student-wide declaration that this is something that should happen, you actually have a lot more power than you might appreciate. And I think that is something that you should just not forget. So that, I think that's one huge thing. I think some of the work that she has done in terms of trying to sort of formalize, you know, hypothetically, you know, how much worse is it for adults on the South Side compared to kids on the South Side. Some of the students have done a lot of really great work trying to dive into the academics of the issue and sort of good classic University of Chicago fashion, and I mean it's like wide open. You know, you can argue it on an emotional level, on a personal level, or on an academic level. The argument holds on all of those different levels, and I think approaching it from multiple tiers is totally effective because somebody's bound to hear at least one part of that. And I think the other thing is actually partnering with government, the Illinois Department of Public Health. I really like the idea of declaring this a public health emergency. And now IDPH, the Illinois Department of Public Health, has to say, hey, we got a public health emergency. We're the Illinois Department of Public Health. We got to do something about this. And all of a sudden, you redirect some resources into fixing that problem by acknowledging that this is a public health problem. And I think partnering with state government to try and make that happen is another effective way that this can change.
Yeah, I'd reiterate just quickly using using the tools of public health and data and quantification and integration within the state and with other trauma experts. Poet Audre Lorde said you can't dismantle the master's house with the master's tools. And I think that's ultimately true. If this is going to change, it's going to take a movement, and a social movement, and people on the ground and protest. But you got to know the master's tools too, and I think that's a great contribution the students have made, is to understand the maps, understand travel times, work with other experts in the field, and keep pushing that forward. I know from working on the inside that it's wrong, but that's heard in a different way, and I think that's an important contribution. It's not the most important contribution, but it's one that students have a unique position to keep putting forward.
All right, thanks. We're going to do some of the questions from the audience now. So the first one is, are trauma patients on the South Side primarily gang members with gunshot wounds? If that's the case, wouldn't it be better to spend limited resources on fighting gang violence instead of patching up the wounds?
I'm going to answer that first. Mainly in this community, yes, 9 times out of 10, you feel me, it's going to be a gangbanger, you know. It's going to be a young black gangbanger, you know. But even if you did give resources to stop the gang violence, that's not going to stop people from getting shot. You still going to have people out there, crazy people out there, still shooting people for no reason. You're still going to have that whether you're in a gang or not. So that's not going to do anything to me, to be honest.
And that's a good point. And that's how community people feel. And like to really get into the answer to that question, like we would have to like bust out the chalk and break down some stuff on the board to like really get to the root of that. Cause like gang violence, if it was solvable, it'd be solved.
I think that's the biggest point right there. It's like
if it was and if it was in the interest of this state to solve gang violence, it will be solved, right? From just knowledges of anybody who studied people like the Black Panthers and studied movements like that, who have, you know, taken that stand and said that, to be honest, just like much of everything that the black culture has done in this country has been infiltrated somehow by the state, by the government, by the FBI, and there has been things to poison our community. And gangs are one of those things. A lot of the problems with the gangs come from why there's so many small gangs that are so close to each other now, is because when all those housing projects went down in the early 2000s, all those people were all of a sudden spread all over the place, right next to each other, and nobody knew how to do that. That was an entire structure that was gone that created chaos not only in communities and schools, but in gangs. And it's not our job to solve that. It's not our job to fix that. We didn't create that poison, that problem. And to say, would it be worth more to put money into that over actually treating people and helping people? That sounds like a question that, I don't know, somebody from the university would ask. It sounds like a trick question, though.
But I think as a healthcare practitioner, I just feel like it's my responsibility to take care of anybody that's ill, and I can't put a judgment on how you got sick. Just like I can't be mad at somebody who comes in with a sexually transmitted disease. I can't be like, oh, well, you got AIDS because you were being irresponsible. So, you know, sorry, peace out. You're going to have to go take care of it yourself and go up to county. Like, that's just not, if you're a hospital or a healthcare provider in a community, I think your responsibility is to just do that job and not to place judgment on certain things, saying certain things deserve care more than others do. So.
And also, I don't know the numbers, but I also expect that most of the traumas in this neighborhood are not gunshots. It's not a question of gunshots, it's a question of care and equity of care. You know, car accidents and falls and other things are probably the bigger burden.
Yeah.
Great, thank you. So the next question is more for the representatives from Fly. Do Southsiders know about this issue, and how can existing nonprofits, community CBOs, etc., on the South Side rally behind this in a realistic way? what would be useful?
I think the most thing that will be useful is people to speak honestly about the university. I think that's been the biggest barrier that we have, is that politicians, prominent people, people who could really have some type of leverage, some type of clout that could really help us break through something, will not speak candidly, openly, and honestly about the institution that is the University of Chicago. And that's hard, because that's what we're talking about. They keep getting all these awards and all these things, and it's so great, and it's just like, can we please, like, get to a point where we're being real here? One of our chances, how can you ignore it when we're dying at your door? And I feel like that's the realest thing that you could say that speaks to the character of this institution. And I think that if we don't get to, like we said, when we talking about trauma, when Obama comes to Hyde Park High School and he stands there and speaks, and he says that the issue and the answer to our violence problem in Chicago is gun control, it doesn't help. It hurts, because we in this room, a lot of us on this table can all agree that gun control is not what causes a lot of the real problems that we have. It's poverty, it's poor people, it's money hungry people with all the resources, it's a lot of different things. And if we are not being honest and not accepting things just because they're constantly said, then there isn't anything real happening. We're not going to get to a real place.
Great. The next one is maybe more for doctors, if whoever wants to answer. What are some arguments in answer to people who say the duty of the U of C is to be an academic hospital? How do you defend the fact that UCMC should not only focus on research? How are they obliged to that?
What is an academic hospital?
In a tower somewhere. Not good. Yeah. An academic hospital is a referral hospital. It's a place of potentially of excellent care, and artificially cutting off one of our arms is no way to be an excellent academic center. One of the struggles that we'll have that I've had trying to advocate within the system is most doctors agree that this is an issue, and it affects our training, it affects the quality of our care, it affects what we can do within the hospital, before we even talk about the community and the justice issues behind it. But to get those people to come out and speak honestly, to tell the truth, is a bigger issue. But I think it affects this academic institution tremendously. We're not as good as we could be, since we're not doing everything that's possible and needed.
I think it's not a fair argument that we should just be an academic institution, because if you look at our peer institutions around the country, and you name the peer institution, and they're a level 1 trauma center for their communities, regardless of where they are. I mean, you might be Hopkins, where you're in kind of a rough part of Baltimore, they're a level 1 trauma center, or you might be, Massachusetts General, and that's a trauma center, and that's in a pretty nice part of Boston. Or you might, you could go to all of the major academic medical centers, and within their confines, they all provide this kind of care. So to me, we're the exception by not doing it, and I'm not sure that that's an exceptional way that we want to be.
Next question is, are there any legislators who support this?
Senator Maddie Hunter, State Representative Flowers, Alderman Luke Cochran, Congressman Bobby Rush. I know I'm forgetting somebody. But those are the people I can remember. and we are talking to more people and getting more people to speak to their aldermen and their state reps. And we've also put more thoughts now to speaking to commissioners and Cook County people, because we feel like IDPA should be in on this, and county should have something to say, especially with all the talk of Providence possibly hosting a trauma center and the university doing something to support that.
I think on the political level too, a massive lost opportunity is the university, since the university is choosing to ignore this issue, its political clout is not being used in the right direction. So there's a question of whether this university will open a trauma center. But almost separate to that is, what are our very powerful, very connected people doing to help the issue? And so really the silence is kind of having a double negative effect there. Politicians are swayed by the silence of this university, and that needs to change.
Okay, great. All right, next question. What are the implementation issues of opening a trauma center, especially with regard to operating costs? Once it gets established, can it be maintained?
I guess I could probably answer that one the best. The thing that you need to have a trauma center is you need operating rooms available 24 hours a day. You need anesthesia staff available 24 hours a day, and you need some basic surgeons available 24 hours a day. You also need some specialized surgeons available. They can't be out of town. They got to be able to come in within an hour if you need a specialized orthopedist or an ear, nose, throat, or a neurosurgeon or cardiothoracic surgeon. So all of those levels of availability have to be present. So the initial process of setting up the trauma center has been estimated to cost anywhere between $20 and $40 million. And then the annual cost to maintain the trauma center, I can't really get a straight number about how much that would be. I kind of wish that, the university has said that they've done sort of the calculations themselves, and they've said this is not something that we can financially afford. And I guess what I would like to see is just what are those numbers, because then we could actually start to think of ways of addressing the issue outside of the box that maybe haven't been addressed. So, maybe it's $5 million, maybe it's $10 million a year. What the university said is that 26 years ago, when trauma center care was provided at the University of Chicago, that they hemorrhaged money. And we've talked a little bit about why that is, because most of the trauma patients either have only like government Medicaid, or they have no insurance at all, and so that's essentially uncompensated care. And some say, well, maybe Obamacare, since it's providing at least the opportunity for more people who are poor to have an insurance option, maybe that would actually help buffer this a little bit. And so I would say, hey, can we run the numbers again? Let's look at this and see if this is going to be such a money-losing prospect. But the reality is I don't know how much it would cost on an annual basis. I have heard 20 to 40 million. I know Bobby Rush had talked about actually earmarking up to $100 million to try and get this thing going. But what it means is having a lot of staff available 24 hours a day to be able to kind of drop everything and focus on trauma. That's what we have in the pediatric unit. When I'm on service, I get a page that says, trauma, 5 minutes. And so then I'm down in the trauma bay, and, sometimes it's penetrating trauma, and it's like some dude stuck a, hairpin in his, that's not really a problem. Or sometimes it's actually like the real deal, a knife or a gun or some other much more dramatic penetrating trauma. And you need to know that you have all of the backup that you can have to provide the care that you need. And that is what doesn't come cheap. So it's the combination of that being expensive and the fact that a lot of the folks on the south side don't have health insurance that drives this problem up. Will the ACA help? I don't know. Nobody's ever done that set of calculations because nobody knows what the impact is going to be. But those are some of the ways that this has to be thought about if we want to practically move ahead.
first one is for the doctors. Some people say that doctors, nurses, and professors are sympathetic but can't give outright support to the trauma center cause. How vulnerable are they really to losing their jobs?
Not. It's wimpy. I don't know what kind of pressure or kind of odd looks you get. I get a little, people aren't praising me for doing this work, but there's no risk. There's no risk. Especially if we do it together. I think it's one or two sticking our necks out, maybe there's some issue there, but there's no risk.
Yeah, I think that's the case. I mean, it'd be one thing if we had like personal financial gain, but what we want is just what's best for the community, what's best for our patients. We don't do this for ourselves. We do this for the people that we serve. And I saw that the university released their sort of like little free speech manifesto a week or two ago in response to what happened last year. And I started to look at it and I was like, oh, heck with this. Because, it's not going to change how I behave. And I think that if I were to lose my job, which I'm not afraid of doing over this, but if I were, then I wouldn't want to be here anyway, and I'll just go work somewhere else that values free speech and a focus on the community.
Does that hold true for faculty and staff who are outside of the hospital?
I assume so. There's nothing wrong in fighting for what's right. I mean, it's just not. I assume so.
I mean,
I don't think we're protected in any special way.
Yeah, there are a lot of faculty that say a lot of things that are kind of edgy or racy or really out there, and that's one of the things I like about being here. It's like the most conservative economic school of thought, and it's right across the street from that like social services administration school, which is a whole bunch of liberals, And so it's by and large, I think, if they got the slightest bit of a hint that there was some suppression of people's freedom to speak out on issues. They'll go down real fast in that context.
Why don't we all find out?
All right, this is last question for everybody. Okay, so regarding the Obama Library, or the proposed Obama Library, isn't it ironic that the university would house it? What do they think about this form of engagement?
I don't think it's ironic. I think it's obvious. It's the university that gets everything. So why wouldn't they get Obama Library? Michelle Obama, Rahm Emanuel, they all in bed together. So of course, it's only right. The thing that is ironic is that it hasn't been questioned yet publicly, anyway. But the problem though, and this is what we go back and forth sometimes when we're talking about in our meetings, is that it continues to promote this message that there's nothing wrong with the University of Chicago. It continues to promote this message that they deserve because they do so many great things and so much great stuff for so many people with health insurance. So they deserve all of these public things. They're a not-for-profit hospital that's worth $1 billion. It's like, I would love to see the Obama Library across the street from Hyde Park High School. In a community area where the community people can go, man, we really have something to be proud about in our community. Like, that's another thing. Like, you see devastation when you live on 62nd and Halsted in Inglewood. When you stay in these areas where that's constantly being talked about, you see devastation every day and you don't see any relief. And the university just continues to see growth. I mean, y'all go here, right? It look like growth, don't it? Yeah, it look like it's growing every day. And that's like, I think it's ironic. I think that's the only irony in it. Is that they would take something that could be such a beautiful addition to any Southside neighborhood and put it in a place that's already like a rainforest metropolis of beautiful buildings and resources already as is. Like,
I'll say. Yeah. I mean, you know, I think a lot of, like, as a resident of Hyde Park, I have a love-hate relationship with the university, like many people do. You know, on one hand, you're like, hey, this is great. They're investing and all that great stuff's happening up at 53rd, and this is great, and that's great. On the other hand, you're like, oh, God, they're a little bit like the evil empire, and you can kind of hear them go, don, you know, and they're just sucking up buildings everywhere, and they're just growing, and you know, they're going to totally change who Hyde Park is and make it and take away the identity of what Hyde Park is, and you know, and I feel a little bit like that with Obama too, because I mean, I like him, and I like the fact that he came from here. On the other hand, I've been disappointed by a lot of what he's done, and so, you know, I mean, I think on the whole it's great for the community if the library ends up down here, but I think it would be great if it were really engaging the community and not just for the university's benefit. And I don't know, you know, I got all these, you know, sometimes I'm like, man, that Obama, he's something else. And then I'm like, man, that Obama, he's something else. You know, it's like, man, the University of Chicago is great. And you're like, God damn it, what'd they do now? You know, you're always feeling a little bit divided, at least I am, about this. But in the end, I just work to make things better.
Awesome. Round of applause for Thank you so much to all of you for coming out and sharing your stories with us today. As you just heard, this is a serious issue that affects all of us on the South Side, regardless of our age, our race, our gender, or occupation. And that is why it's going to take all of us to come together to build power and create change. I know I speak from personal experience when I say how wonderful it feels to be surrounded by so much solidarity in this movement, and that I truly believe that each and every one of you can bring something unique to this campaign and help, you know, achieve our goal. As you walked in, you all received a flyer that highlighted some events that we have for the Climate Progressive Quarter. So first of all, Students for Health Equity meets every Monday night in Cobb. We will put a piece of paper on the railing that'll tell you what room to go to. Anyone's welcome to come. That's every Monday night. Also on Mondays at 5 p.m. we have our weekly picket, and that is at 58th and Cottage Grove. So anyone is welcome to come out and join that action. And also on Fridays at 5 p.m. we have our weekly Ferrisburg Center event. So anyone of any faith, of any religious practice, is welcome to come out to the Camp Center. That's on 50th in Maryland, and we'll meet in the lobby for some time of prayer. So again, thank you all so much for coming out tonight, and also a big thank you to Student Government Financing Committee and the Campus Dialogue Fund and the Urban Network, who all helped make this event possible. Please feel free to stick around for a little bit, eat some more pizza, talk to our panelists, or talk to the members of SHE, and yeah, sorry.
We're also, if you also would like one of these nice shiny Chicago Community for Trauma Center buttons, like we're all wearing right now, then if you come to the front, we're selling for like $3 or whatever you want to give. But it's like, yeah. So that'll be up at the front as well.
All right, awesome. Thanks so much, guys.